Jamary, and I'm one of the nurse practitioners here at Lighthouse Medical Center. For those of you that don't know, I specialize in regenerative and aesthetic medicine. So a lot of times when patients come in looking for a Botox consult, I get a lot of the same questions. So today I wanted to discuss 5 myths about Botox. The first one that I normally get, and is probably one of the biggest ones, is, does Botox hurt? And not really, actually. The needles that I use to inject the Botox are actually insulin syringes. So they're super, super tiny. We don't usually typically numb. However, if you do have like a phobia of needles or anything, I'd be happy to provide a little bit of like a topical anesthetic that'll help decrease the discomfort even more. The other thing is the injections are super quick. So it really, you can come in during a lunch break. It'll take about 10 minutes and you'll be in and out in a breeze. Okay. So now that we've discussed pain, one of the other main concerns that people come in with is they don't want to have a frozen face. They don't want to look unnatural, and they still want to be able to have an expression. So if you go to a provider that's well-versed and very knowledgeable with Botox, you should still have movement, and you can still make all the same expressions that you normally would without Botox. So it's an art. So that's why it's really important when you're choosing your provider that you make sure that they have a lot of experience injecting Botox and that they know how to properly use the product. So in here, we'll insert some pictures, some before and afters, and you can see that some of these patients, they still have a lot of their expressions. They're still able to animate and still be themselves, however, not creating those excessive lines that are sometimes can be a little unsightly and can cause those deep set wrinkles that we don't want, that show signs of aging. So another common misconception is, will my wrinkles get worse if I stop doing Botox? And the answer is no. So we all know Botox is an expense. However, the more that you do your Botox, the more that it's going to diminish the wrinkles. If you do decide in time that you do want to stop or have a pause in your treatment, your movement is going to return to its previous state in a slower fashion. So eventually you're going to go back to what it was before you started your treatments, but it won't get worse. The fourth myth that we're going to talk about is Botox toxic? And I can't even tell you how many times I get this question. So people hear Botox and I'm like, oh my gosh, it's from botulinum toxin. You're putting a toxic material into my body, and this is not true. So Botox has been around for a very, very long time. And it's actually an isolated protein from the bacterium botulinum toxinum. So, and it's a very, very small amount. It's actually kind of interesting how Botox was found. They were using it to treat eye twitching and strabismus and cross-eyedness. And they actually found that when they were treating these disorders, they were having an aesthetically pleasing result, meaning it was diminishing the wrinkles in those areas. And that's where kind of medicine started to turn, and they started to investigate the uses of Botox for aesthetic results, which is what leads us here today. So to answer the question, no, it's not toxic. It's just an isolated protein, and it works very, very well at treating not only aesthetic, to give aesthetic results, but also various other diseases as well. So one of the other myths in regards to Botox is that it's only used to treat wrinkles. And kind of how I mentioned in the previous myth, it's actually been around for quite some time and can treat various different disorders, including hyperhidrosis, strabismus, some bladder disorders and dysfunction. So it really has multiple uses. People often ask, like, when is a good age to start doing Botox? And really there is no specific age. It's really patient dependent. So every patient is different. Some patients at the age of 25 may already start showing signs of static lines. So static lines are lines that are there at rest. Dynamic lines are lines that we create as we animate. And the key with Botox, especially for an aesthetic result, is trying to get those lines before they've gotten deep grooved in. Because once they're deep set, it's much harder to treat them, it's much harder to get them to fully go away. We can also use Botox to achieve other aesthetic results and not just wrinkle reduction. A lot of people complain of a dimply chin, and Botox works really, really well to improve that dimply chin when they make faces. It can also be used to improve a gummy line, a gummy smile. And we can also use it, a lot of runners and very thin, active, particularly women, they get these platysmal bands, so these really accentuated neck bands, and Botox works fabulous to diminishing those neck bands so they're not as prominent, giving you a much more youthful and aesthetically pleasing result. Thank you guys for joining me today. I hope that I was able to answer some of your questions. If you have any other questions or topics that you'd like for me to cover, please leave them down in the description box below, and we'll make sure to cover them and get a video up for you guys. Thank you so much, and I look forward to seeing you guys again.